This question is for the Premier. Last week, Ontarians were shocked to learn that the government ignored the advice of public health experts when developing its latest COVID-19 framework. But for parents, teachers, and education workers, Mr. Speaker, it was less surprising. Because when it comes to schools, this government has ignored expert advice for months. Those experts said that to prevent outbreaks, classes should be kept at 15 students or fewer. But rather than put forward the funding to make that happen, this government has let classes grow larger, along with the risk to our kids and school staff. With the pandemic surging out of control, will the Premier finally listen to the experts and stop collapsing smaller classes into bigger ones? Thank you, Mr. Speaker.
To reply, the Minister of Education.
Thank you very much, Mr. Speaker. I appreciate the question from the member opposite. I will note, Speaker, that our plan brought forth and supported by the Chief Medical Officer of Health has helped ensure we have reduced the risk within our schools. I will note for colleagues, amongst the 1.5 million children within our schools today, there are roughly 664 active cases. And when you juxtapose, or you compare rather and contrast Ontario's approach to reopening, following the advice, ensuring the resources and financing is placed with Quebec, an equal comparator, they have roughly 1 million fewer students. We have 50% more students. We have 30% more schools, and yet they have almost 2 times the rate of COVID transmission within our schools. We have improved and rather put in place every layer of prevention to mitigate the spread and to make sure that schools remain safe places. It's why in Toronto and in regions right across this province, in every school board, funding is up. And as you know, within the budget, there's additional funding put aside to ensure that our kids remain safe through the worst of this pandemic.
Answer question.
Thank you, Mr. Speaker. The minister has stood here and assured us for months that everything is running smoothly, but it's cold comfort, Mr. Speaker, for the anxious parents who are looking at exponential case increases. It feels more like this government is asleep at the switch, offering zero new dollars in the budget to protect our schools. I am thinking today of the parents, the students, and staff at Turner Felton Secondary School in Brampton who got word on Friday that there was an outbreak at the school with 5 confirmed cases, 5 closed classrooms, or the families at 683 other schools across the province with reported cases right now. After last week's color-coded framework fail, the Premier reversed course. Will he do so again and fill the gaps in his school plan before any more families have to go through the stress and anxiety of an outbreak? Thank you, Mr. Speaker.
And the Minister of Education.
Mr. Speaker, I think we should be informed by the medical experts who have opined on the plan. In the words of Dr. Michael Silverman, the Medical Director of Infectious Diseases at St. Joseph's Hospital in London, quote, "For the vast majority of children and the vast majority of teachers, this has been a safe and effective intervention that has led to children restarting their education, which has led to long-term benefits for us all." Mr. Speaker, in this province, while we see transmission rise, there is 1 school closed in Ontario. 85% of schools have no reported active cases at all. 664 students have active cases of COVID amongst 1.5 million children. I do not take for a moment the great levels of angst that all of us face as numbers rise, but within our schools, given the incredible work of our public health and our school boards and our teachers, we are seeing rates of transmission remain low, and that is a good thing.
Response?
And that's why, Speaker, we invested $1.3 billion, fully supported with a protocol endorsed by the Chief Medical Officer of Health, and we should have confidence within our frontline staff, teachers, doctors, and nurses to do everything they continue to do to keep COVID out of our schools.
Very much.